The Ministry of Health officials are expected to fumigate an area that is believed to have been the residential place of the individual who has been confirmed to have the disease. Leila Mohammed is in Ongata Rongai following up on that and is joining us live with more details. Leila, what have you been able to establish so far?
Well, most of what is happening here is happening behind these closed doors at this facility. Maybe we can just take a look at what is happening. We were expecting Kajiado Governor Joseph Olalenku, who's probably one of the many of these who are arriving here. He was expected to come here to inspect a mobile unit for inspection of the coronavirus symptoms within this area code. There have been meetings between the Kajiado County government and the national government of this country. The CEC for Health from Kajiado County was at the Ministry of Health headquarters earlier in the day. So the information that we have as we speak is that there have been several officials who are inside. There have been several meetings, but the most important thing would be to ensure that there are enough chemicals or insecticides to ensure that the place where this particular individual who resided within the vicinity of this area there can be enough to ensure that the home is maybe just kept clean, because there has been sort of a panic ever since reports probably that young girl lived within this area. Remember, the African Nazarene University is just a few meters away from here, and it is one of the institutions of higher learning that have suspended their classes until this issue has been contained within this area code. So the most important bit here was we were waiting for the Kajiado governor as well as other officers from the national government who will be in a meeting here. As it now, what we are being told is that this will now be the inspection center for this county, this particular area. This is because the first case that has been announced in the country is said to have begun from here. That person was a resident of this particular area, and so a battery of journalists have been gathered out here for the better part of the morning, waiting for clear details or directions on what to do next. We know that Kenya was the first African country, followed by Ethiopia, and then again we hear Namibia. A couple from Spain has been given confirmation that they are suffering from coronavirus. Since 48 hours ago, the WHO has considered that it is now a pandemic. So that is why we are seeing a lot of attraction from international press also here in this particular afternoon. The government says now that at 5 o'clock they will be able to give us more details as to what is happening in terms of awareness. Are there any new cases? They had planned a drill that was expected to happen on Sunday. Will that go on as planned, or what next for Kenyans? Yesterday, the main point of authority they were looking into was the public transport sector, and they were urging all matatus and buses and the rail users to ensure that they have sanitizers on hand so that to avoid or to contain further containment of this particular virus that has ravaged various parts of the world. We are at 100,000+ infections from this particular virus that scientists are currently doing all their level best to ensure they have either something that can suppress it. But at the moment, Kenya has just only that one person. Maybe later in the day we'll be able to get more details, but as at now, nothing much to report back. These meetings have been going on, and until they come to address the situation, we might not be in a position to give you more detail. However, there have been some concerns by residents of this area. What next for them? How do they protect themselves? How do they know the signs and symptoms, which according to them, they say can never be enough information for government to come out clearly and tell them this is how to behave and this is what to do. Something with which the CS of Health yesterday was saying self-containment is one of the ways of actually suppressing the further breakout of this virus that has hit many parts of the world, including Europe, which is now the epicenter of the disease.